Hello, everyone, and thank you for joining us. My name is Debbie Madeley. I'm the Development Director at the North Suburban Y. It's my pleasure to welcome you to Healing Hip Pain Naturally by Denise Schwartz. Denise is a licensed physical therapist specializing in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. The YMCA Education Series typically lasts about an hour. Denise will take questions both during and at the end of the presentation. If everyone again could mute themselves during the presentation, that would be awesome. And then at the end, you can unmute for questions. With that, please welcome Healing Hip Pain Naturally with Denise Schwartz.
Thank you, Debbie. I'm going to share my screen here. Okay, Debbie, if you're still there, can you see my mouse moving around?
I can.
Okay, good. That's what I wanted to know. All right. Thanks for having me, Debbie. I'm glad to be back again. I've been doing these talks for quite a while now. As Debbie said, I'd be happy to take questions at the end of the webinar. You can either write in the chat box your questions or save them for the end, and we'll come back on to video. Right now, I can't see anybody. I can't see myself, so I won't be able to see if you have a question. So it's much easier if we do it at the end. All right, so today we're going to talk about hip pain and what we can do for that to help you heal naturally. So as Debbie said, my name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. We use a whole body approach of traditional and non-traditional therapy to get people back doing the things that they love to do. I started out my career many years ago working at Lutheran General Hospital, working in the hospital, seeing people there. Within a couple of years, I just saw people in outpatient, which is what I currently do now. When I first got out of school, I knew that back pain was the #1 reason people went to see their doctor. So I took a lot of education classes to become an expert in healing back pain. And along the way, I've taken many classes on how to heal all sorts of aches and pains. After a number of years, I started studying a non-traditional therapy called integrative manual therapy. And this was an approach of looking at the body as a whole and what is preventing someone from healing. This is a hands-on approach. And what I found is I could help everybody with this approach. Prior to learning that non-traditional, doing more of a traditional type of approach, I could help a lot of people, but there were some people who just didn't respond very well to traditional physical therapy. Those people really responded to this more non-traditional approach. I left the hospital to work for the company, Center IMT. We started the clinic here. We had one in Wheeling and in Elmhurst. And then in 2010, we parted ways and I opened the Manual Touch Physical Therapy. And while I was working for this non-traditional company, I sort of abandoned a lot of my traditional skills. And I realized I missed that, and there was a lot of benefit to that. So now I combine the two and use both traditional and non-traditional hands-on manual therapy and exercises looking at the person as a whole. Along the way, I developed a passion for running, although in the last few years I stopped. And I became an expert in treating runners as well. Here's my son. I'm doing a video analysis looking at someone running. We take a video because you can't see with the naked eye what's going on. So this way we can look at in slow motion and see if there's some issues going on. This is applied functional science. This is an exercise approach of looking again as the whole body. So someone comes in, let's say, with hip pain. It could be because it's coming from their foot, or it could be coming from somewhere in the back, or coming up in the upper back. So it's looking at what isn't moving, what is moving, what's doing too much, what's doing too little, looking at all the picture. And then in the last 5 years, I added this phenomenal device called an OOV. There's no rhyme or reason why it's called an OOV. It was created by an Australian osteopath biomedical engineer. It is designed to, because you can see sort of the shape of the spine, and you can lay on this on your back, on your stomach, your side. You can stand on it, and it works your body three-dimensionally, so you cannot compensate. And it has been like the best tool I've had to really teach people how to use their bodies optimally. I can get you laying on your back. Here's an older gentleman. I have it between his back and the wall. So, you know, a lot of people tend to get a little bit more slumped as they get older, and this will help pull you up. It'll open up your diaphragm and your thoracic cage so you can breathe better. Here's my son again doing a much more advanced technique on one leg and pulling down. And here's an older person doing some, putting his foot on here. We're going to do a step over. So any age can use this. I have my older folks, some of them can lay down on it and some can't. Doesn't matter, so we can do any variety of things. During the pandemic, the same designer created this device called a balance sit. And this is something you can sit on to help get that nice core control here. This works really well with my hip patients because it gets your hip in alignment where we want it to be, really re-educating your muscles to work optimally. So many of my patients will purchase one or both of those devices to do at home. They really, really like them. And I find it's really been, I almost don't know how I really re-educated my patients to move properly without it before. All right, so now let's move on to hip pain. You know, many years ago now, we used to see you in person, and I would ask people, you know, what are your complaints? Where do you have pain? So here are some of the things that I hear from people who have hip pain. It hurts when I sit for too long. It hurts when I stand too long. Walking increases the pain. Sometimes it increases the pain and then it eases up as they keep
on my side.
Laying on your side. Yes, I heard someone. You know, be helpful though if you mute your Zoom. Okay, just in case we get background noise. But you were correct, laying on your side. Sometimes laying on the side where the pain is worse. Sometimes laying on the other side makes laying on the side that doesn't typically hurt may hurt the other side. So either way can be a problem. Putting on your shoes and socks, bending down, squatting, initially standing up after sitting a while. I can't do what I normally do. I can't run. I can't play pickleball, tennis, bowling. You know, people who sit and play cards, you know, because they can't sit too long. Driving. People will say that they just feel stiffer, like their hip just doesn't move like it used to. Rolling over in bed. Incontinence. Sex might hurt certain positions. I feel weaker, you know, my knee buckles on me driving. So there's a multitude of complaints that people have. They're all valid, that all can have something to do with the hip complex. And what I mean by that, it may or may not be the joint, or it could be the muscles around the hip, or it could be coming from your back. So we have to just sort of discern where is the pain, wherever you're feeling it, what is really causing it. People refer to their hip, and I have to ask them, where on your hip does it hurt? Is it in the back, in your buttock? Is it in the front? Is it in the inner thigh or groin area? Or is it on the side of the hip? Any number of those places, people, it can be considered your hip, a component of the hip complex. The most common causes of hip pain that I see in the clinic, there are certainly other reasons, but this is what we see most of the time. It could be some arthritis or degenerative joint disease. Could be just weakness. People have weakness in their hip, and that will cause pain because you use those hip muscles all the time to move. And if they're weak, they can't function the way they need to, and it begins to hurt. And then, of course, you can have a tendonitis or bursitis in any number of muscles in around the hip complex. This is an ebook that I've created for you to learn how to move throughout your day, so you can avoid having any types of pain or aches. So if you put your name, first and last name, and your email, I will be happy to send you this ebook. So put it in the chat box, okay? All right. So before we talk about the different diagnoses, we're going to talk about the hip and some anatomy. Let's look at this side. This is your hip joint, the bones. This is the long thigh bone called your femur. And you can see it's very long and it bends up, and there's a ball at the end of the hip joint. It goes into a socket, which is in your pelvis. The pelvic bone is made up of 3 bones. This is the ilium. The ilium back here. This is the pubic bone. And down, well, it's hard to see. There's the ischium, but that's on the back side. The hip joint, the ball of the femur sits in a socket called your acetabulum, and that makes up the hip joint. It literally kind of looks like this. So kind of like that, okay? So when you have hip degeneration, the space between the ball of the femur and the socket of the acetabulum gets narrow. And so does,
they say that
jams against the bone.
Kenosha and upper Illinois is going to get 7 inches of snow.
Maybe Debbie, you can mute everyone. Thank you. Okay. All right. So that's the hip joint. All right. So over here is if we took all the muscles off the front of your body, if we took all your guts out, these are the front hip muscles. This one is a very long muscle called your psoas, P-S-O-A-S. It's your hip flexor. So when you march or you lift your hip up while you're sitting, that's what that does. It also works as part of the front core. This is a deep muscle in here called your iliacus. It's on the inside of the hip. What's interesting about this hip flexor muscle, you can see it attaches to your spine. Okay, and it comes all the way through and attaches down into your femur. It kind of looks like a pork loin. So you could have middle of your back could be sore, and it could be coming from this muscle. You could be having tenderness here in the front of your hip, and it could be coming from this muscle. So it's very important for us to look at what's going on in your spine here as well. These are the inner thigh muscles, your hip adductors. Remember, I tell you, I look at you as a whole picture. Here's your skeleton. All right, that hip joint is connected to the knee joint, connected to the, well, I guess it used to be the hip bone, connected to the knee bone, but knee joint to the foot. And you can see the pelvis here is connected to your spine. It comes up here to your shoulder, and the spine comes up to your skull. So you can have a problem anywhere. And it can cause pain somewhere else. So it's really important to look at you as a whole. I think when someone is coming to me with hip pain, I really want to know what's going on in the back and really what's going on in the foot, okay? The knee goes along for the ride. Whatever the hip is doing or not doing, or the foot is doing or not doing, the knee takes the brunt of it. This is the muscles looking at it from the side. All right. So here's your butt. You actually have, people often have heard of the glutes. You have 3 glute muscles. You have a glute maximus. That's the really big outer glute muscle. It's really super powerful. Then you have the glute medius, which is on the side. And then underneath that is one called the glute medius that we can't see in this picture. On the side of your hip is called your tensor fascia lata, TFL, and it connects to the IT band down here. Here are some hamstring muscles, and this is some quads. The next picture is going to show you the pelvic floor and the deep hip, deep core muscles. So if we take that big glute muscle off, okay, you can see we cut the big glute muscle off, okay, and then we have, I think that's an error. Oh no, there's the glute medius there, okay, minimus, okay. You have all these little muscles underneath, okay. These make up your pelvic floor or your deep core. Now here's your core muscles. The core is made up of everything below the diaphragm all the way down to the pelvic floor. Okay. So these little muscles making up your pelvic floor, they rotate your hip. So in order to bring your foot up onto your other, cross your leg, like to put on your shoes and socks, that would do that. If you were to sit cross-legged on the floor. But you know, when we walk, our hip actually goes through a moment where it does rotate. You just don't know it. It's subconscious. You can't really see it. Those of us geeky physical therapists see if you are rotating or not rotating. Some people, you know, some people walk kind of like a duck or a penguin, and their legs are always externally rotated or turned out. Some people are turned in and they walk what we call pigeon-toed. So that's what those muscles, their primary movement function. But their biggest role is to stabilize your pelvis as you move. And then the next piece is they make up your pelvic floor. So it holds in your guts. It holds in all your abdominal, the inner tissues of the organs of your body. Okay. 9 times out of 10, this is the problem when somebody comes into me with pain anywhere. They almost always have some weakness here. People have figured out subconsciously how to use their bigger muscles out here. They get fatigued. And so these little guys turn off and they're not being used. You overuse out here, you develop some tendonitis. You can see these little muscles all attach onto the hip bone, your femur, at a place called your greater trochanter. Greater trochanter. You can see it's right here, okay? So if any of you have gone to the doctor with some hip pain on the outside of the hip there, and they told you you've had trochanteric bursitis, that's where it is. But all these muscles attach there, so you could have a variety. You could have bursitis there. You could have tendonitis where it's connected there, okay? This is the back of your hip, the back of the pelvis, the back of the spine. This is your sacrum. This is the ilium. It connects to the sacrum, making up the sacroiliac joint or SI joint. Sometimes people come in and say their hip hurts. And when I ask where, they point to here. And that's your SI joint. So it may not be your hip, an issue there. It might be something going on in your SI joint. This is the third component of your pelvis. Remember, I said earlier, you have 3 components. This is your ischium, and it's called the ischial tuberosity, and your hamstrings attach there. So if your hamstrings are tight, you can get pulling back there. Out of your spine and the sacrum comes the sciatic nerve, and it goes back behind your butt, underneath, and over some of the hip muscles. So sometimes you have some compression on that sciatic nerve coming from the muscles here because you have a strain in your piriformis, or you have something going on in the sacrum here where it's kind of pulled on this muscle, making it tight, compressing the sciatic nerve, or you have something going on in the spine. You have a disc problem, you have a stenosis problem and compression. So you could come in with some numbness and tingling in your leg or some achiness in the leg that's coming from the sciatic nerve. It may be coming from your spine. It may be coming from the sacroiliac joint. It may be coming from a muscle here. So we have to discern what's going on there. I mentioned your core just to show you, every muscle below the diaphragm and above the pelvic floor, and including those muscles, make up your core in the front and in the back. This is your six-pack, which everybody has. We just can't see them through our skin. So that makes up the rectus abdominis. As we get lower, we've got muscles that go on an angle. Those are your obliques. And then deep inside is your transverse abdominis, and that's like a banded muscle that goes all the way around. And it helps support the whole core. When people get heavier or pregnant, sometimes, well, actually it will split. This muscle was split here. But after you, let's say you've been pregnant, you deliver the baby, hopefully those muscles kind of knit back together. Sometimes they don't, and we get a split there. I see in older folks, particularly men, they get a hernia here, and that's because this muscle has thinned out and split, and it's become weak. And so you sit up and you can see like a little alien coming out. That's the herniation. And so people will have a weakness here in addition to these little muscles here. And that's the majority of the people I see have that problem. They don't all have this, but a lot of people do. I'll see, 75-year-old women who still have a split here from when they were delivered their baby 30, 40, 50 years earlier. So it's very important to look at those things. The other issue is people have had any kind of surgery here. It could be a C-section. It could be you had your gallbladder taken out and they stick one probe through your belly button and another probe here and another one here. This scar tissue here in this umbilicus tends to be a problem for a lot of people, and that tightens up stuff, so then their back can't move the way it needs to, and then you overuse some hip muscles and wind up with hip pain. So as you can see, there's lots of pieces that go into figuring out what is causing your hip pain. And I liken that to being a puzzle. So I like to say that we here at the Manual Touch look at you as a puzzle and how to put all those pieces together. Sometimes we look at the outside of the puzzle, and sometimes we got to look at the inside of the puzzle. So we got to look at and systematically figure out where do we begin and what was the beginning cause. Sometimes you don't quite know the beginning, but where do we start to treat you? We can't necessarily start doing you dancing. We might need to start learning how to stand on one leg, or how to even, most of the time we have to learn how to put weight onto the leg that's been hurting. So it's really learning about where to begin. All right, so if you have any questions about anatomy or those questions, put it in the chat box or write them down, and I'll be happy to answer those at the end. So let's talk a little bit about those three common causes. Arthritis. It's a degeneration of the bone. It's a wearing away of the bone. We all will have it down the line. It's like rust on the car. This is what we have. Some people will degenerate faster than others. Somebody who had a significant injury to the hip joint or some joint as a young person will develop possibly arthritis sooner. Thus, all those football players getting hip replacements, in their 40s. People have had, let's say, a significant knee injury, like an ACL repair as a teenager in their 20s, usually have some significant knee arthritis by the time they're 50. So it's good to be active, but sometimes we pay the price. At any rate, so how do we discern if you have arthritis before you have an x-ray? Usually people who have arthritis or significant degeneration will have groin pain. So it kind of hurts down into the inner thigh. We need to discern, is that actually coming from the joint or is it soft tissue? When somebody comes in to be evaluated, I look at to see how much mobility they have in the hip joint, and I move their hip passively. If they don't move in all directions as much as they're supposed to, I will send them to get an x-ray if they haven't had one. I suspect that there's something going on in the hip joint. We know you have arthritis hip joint, usually you'll have some weakness. Somebody who's really degenerating, we can see that there's a change in their gait. They have a really significant limp. There's a really funky way they walk, kind of side bending over it because they can't bear weight onto that joint very well. Sometimes you just have low back pain. And so it's really important for the practitioner to look and see, does the hip joint move? Is it really coming from, does your back hurt because the hip isn't doing what it's supposed to do? Or vice versa. So we always have to discern between that. So sometimes all these symptoms could show up with something else. I think the biggest telltale sign is when I assess the joint passively. If you can't extend or we can't rotate the way you need to, and it's not soft tissue related, then there's usually something going on in the joint, and I have people go get an x-ray. The unfortunate news is if you are told, the surgeon says to you, you need a hip joint replacement and you're bone on bone, sometimes a shot of steroid will manage it, but unfortunately physical therapy doesn't help a whole lot to change that. However, if you can manage your pain, if we can get you stronger and do certain exercises, we can do core work, hip exercises, we can get you stronger and get you ready for that hip replacement. But once it's really at the point where you need it, you really need to get that hip joint. Unlike a knee, some people can live with bone on bone in their knee for a long time and manage it pretty well, and it doesn't disrupt the rest of your body as badly as a hip that needs replacing. One of the other common causes of hip pain is just simply weakness. People have developed movement patterns that do not use their hip muscles optimally the way they're designed to, and so they develop weakness in there. But you have to use those muscles when you move, and so it fatigues quickly because they're weak, and so you get pain. So sometimes there isn't a true diagnosis other than weakness. So it's almost always those deep hip rotators that I talked about. The glute medius is weak. Oftentimes we have to look at the foot. People who have real flat feet or very their midfoot is very weak, that will not allow you to activate your glutes and the core the way you need to. So when you walk and move, the way that your foot functions during gait will help activate your core and your hip muscles to work. If your foot is weak, you pronate too much, you have a flat foot, or you shuffle, you can't push off your toe the correct way, you don't activate your core and your glutes to work the way they're supposed to, so they become weak. You start using other muscles that don't optimally help you move, and then you develop a problem. We call that poor neuromuscular control. That's when your foot is not working with the rest of your body. Neuromuscular control is really about your body not working together as a whole. So that's a big component of when you come in for therapy, we retrain your body how to work together. Here is an example of a woman with a weak hip. So here, if you look at her shirt, when she is standing on her left leg, it looks pretty level. Over here, when she's standing on her right leg, you can see how it dips. So this right hip is weaker, and it literally turns off. The muscle is not working to hold this hip up, and so that one's weak. The other component, particularly for women, that play into the reason we get weak hip muscles is we have what's called a very large angle that goes from the hip to the knee. We actually call that the Q angle. So, our women, our hips are much wider than men. So we will always have a bigger Q angle here, and we will always be more susceptible to a knee problem or a hip problem. However, if we can teach you how to walk and move so you're not in this angle all the time, then we can start using those muscles more effectively. The third most common cause is a tendonitis or a bursitis. Then the question is which muscle has the tendonitis? The bursitis is usually the greater trochanteric bursitis, which I pointed out to you on the spine. It's where the femur bone takes a turn, and it's right at that bony prominence there. But if somebody has pain in the front of their hip, it's usually the psoas muscle, the hip flexor, that has the tendonitis. If it's on the side of the hip, it's usually the glute medius. Sometimes people have a tear there. We're finding that more and more people or surgeons are sending people for an MRI to see if they have a significant tear in that glute medius. I have seen a couple people have gotten that repaired. One person older, an 80-year-old who got it repaired, and a woman in her 50s. Both were helped by it. The person who was younger was significantly helped, where the older gentleman, at least it didn't make him worse. Whereas with the tear, it just wasn't functioning very well. You could also have a tendonitis in the TFL, which is right on the side of the hip above the trochanter, okay? You could have a down in the IT band. You can have pain on the side of your thigh. The quad tendon crosses the front of the hip, so you could have a tendonitis there. Or it could be an SI joint dysfunction. That's not really a tendonitis. I'm not sure where I put that here, but that could be one of the problems. So we ask you a lot of questions to determine where the possibility of the pain is, to differential diagnose it. And it's really important to know what's the diagnosis so we can give you the appropriate treatment plan. What's the biggest mistake people make with hip pain? They ignore it. So how do we know if we can help your hip pain? Well, if it's reproducible. So in other words, you come in and you tell me, it hurts when I lay on it, it hurts when I walk, it hurts when I stand up, but it feels better when I sit down, it goes away. Or I can sleep and it doesn't hurt me. That's reproducible, and we know that you can find a comfortable position that doesn't cause pain. So we know that therapy can help typically. Cases where we know we can't help is if it's hurting all the time, you cannot find a comfortable position. A number of years ago, all of a sudden I developed some back pain. And, you know, I couldn't find a comfortable position to be in. And nothing seemed to, like, I couldn't reproduce the pain. In other words, so when you come in to see me, if I start poking around and like, oh, that's where it hurts when I touch you, or when I resist some strength testing, when I had this pain in my back, there was nothing that reproduced it. And in fact, it got, after about 3-4 days, it was getting worse and I couldn't sleep. There was no comfortable position. I knew there was something, that it wasn't muscular. So I went to the hospital. They worked me up because it was a low back. They figured it must be kidney. Nothing. They decided to send me home. They didn't know what it was. A week later, I scratched my back and I found a rash. So I had developed shingles before the rash. So, you know, it's really important to know if you're having constant pain and we can't figure out how to get rid of it, usually it's something else. It could be something else going on. And sometimes people have that really significant arthritis where they really need a total joint. That could be the problem. Here's a woman that I saw with hip pain. She had it for a long time, many years. And after working with us for a while, she was able to walk around. She said she was able to go to the museum and walk around without any problem and didn't have pain afterwards. So she was very grateful. This one of my girlfriends, one of my close friends now, a lot, and you probably know this, we did a lot of sitting during the pandemic. And then there were people who just went out and walked like all day long, or they increased their activity. So one of my girlfriends did that. She did her usual workout in the morning, and then she added another walk later in the afternoon. And she walked with her sister, who's like almost a foot taller than her. And so she developed hip pain. So not only was she walking now 2 hours plus a day, close to, I wouldn't say 10 miles, probably 6 miles a day. She was probably trying to keep up with her sister, who was much taller than her. So she was taking too long of a stride. And so she developed some hip pain. So when she came in to work with us, and in fact, for whatever reason, she went to see someone else, a traditional therapist, who didn't get her very far. But when she came in to see me, we adjusted her gait. We talked to her about shortening her stride, particularly when walking with her sister. And she really couldn't do that much. She needed to dial back how much she was doing, in addition to really getting to some of those deep core muscles that weren't being addressed elsewhere. All right, so what are your choices when you have hip pain? You can ignore it, hope it goes away. But usually when you do that, you develop compensation, you wind up with something else, and you get weakness and something happens. You can take medication, get a shot, surgery. There is a place for that. Or we can handle it, and that's physical therapy. And hopefully we get people in before they need surgery. They do this. They might need some medication, they might need an injection to kind of get you over a hump, but hopefully we can handle it. So what does the physical therapist do? We will work on your mechanics, making sure everything is working as optimally as it should, give you some dynamic stretching and balance exercises, some strengthening and neuromuscular re-education to get everything working together. We're going to look at your shoes and your gait. Do you need orthotics? We'll do, we talked about fixing mechanics. We do that by using our hands usually, making sure all the joints are in balance the way they're supposed to, help reduce any of the soft tissue restrictions. The exercises, strengthening, mobility, stability, lots of balance work, very important. Working on getting your feet and your core working together, that neuromuscular education. And a big part of my job is teaching you how to live and function. Anybody taught how to sit or stand or walk as a child? No, we just did it. And so when we go about our life, we don't really know the optimal way our body should be moving. So that is our biggest role as a physical therapist, is to teach you how to do these things that we do, that we take for granted. We teach you how to sit, how to stand, how to walk. There may be ways we need to shift your walking. People who come in for running, we might have to shift the way they run. Someone who is doing a sport, we need to look at the mechanics of how they're doing their sport, whether it's swimming, running, tennis, golf. We may need to look at those pieces. If there's any golfers on here, when you go for golf instruction, there's like a billion nuanced little things that you can do to make you function better as a golfer. It's the same thing with everyday activities. Sleeping, how to lift, your posture. This is just a blog post I wrote about how to go and when you're going to look for shoes, some tests that you can do when you're there to determine if the shoes are appropriate for you. And here are some more resources on my website, particularly geared towards hip pain. So if you go to my website, themanualtouch.com, or if you put your first and last name and your email in the chat box, I can send you this PowerPoint, and then you'll have the links that'll take you directly to these blog posts to talk more about hip pain, exercises that you can do, and any other tips. As a thank you for coming today, I'm happy to take your phone call or a telehealth session to discuss what's going on with you. and give you some recommendations on whether you need to get to see the doctor first, or you can come in to see me. This is my phone number, 847-541-7600. The website is themanualtouch.com. I can send you directly if you give me your email, or you can go to my website, themanualtouch.com, and you can download these free books. One's on balance. Here's one on movement. So thank you for coming today. Hopefully that was helpful and you learned something. I'm going to stop sharing the screen here and open it up for questions. I'll stay on and be happy to answer anything you may have. Let's see. Let me see in the chat box if there was anything.
So we have emails for the booklet.
Yeah. Okay.
I don't see questions.
All right. Any questions? Anybody?
Okay. Well, again, thank you all for joining us today, and a special thank you to Denise Schwartz. This ends our YES program for today. You can check out the talk at any time on nsymca.org/YES. We will keep them all as a podcast. And just a quick reminder that the Y Education series is free and open to the public. And as a nonprofit organization, we're always happy to accept donations. If you enjoyed today's program and would like to support adult programming or the charitable work of the Y, please feel free to consider making a donation at our website or here at the Y. Again, thank you, Denise. Certainly appreciate your time and information, and everyone have a wonderful day.
Thank you for having me. Appreciate it. I think I'll be on next month. I think we're doing on neck pain, so keep an eye out for that. And thank you for coming.
Thank you.
Have a good day. Bye-bye.